Serdecznie zapraszam do wysłuchania wywiadu, który miałam przyjemność przeprowadzenia z panią profesor Karen Gribble z University of Western Sydney w Australii. Ja nazywam się Joanna Jurek i jestem doktorantką na Ulster University w Irlandii Północnej, gdzie zajmuję się tematem żywienia człowieka oraz immunologii. W trakcie wywiadu z panią profesor rozmawiałyśmy o tym, jak pandemia COVID może wpłynąć na narodziny dziecka oraz pierwsze dni po jego urodzeniu. Pani profesor dzieli się swoimi obserwacjami i poprzednimi doświadczeniami, które wyniosła, będąc zaangażowaną w badania nad pandemią HIV w Afryce. Razem z panią profesor również dyskutujemy na tematy, jak te obserwacje czy doświadczenia mogą wpłynąć na lepsze zrozumienie ówczesnej pandemii COVID. Również pani profesor dzieli się poradami dla przyszłych rodziców, jak najlepiej zadbać o swoje dziecko w okresie pandemii oraz rozmawiamy o tym, jak karmienie piersią może wpłynąć na poprawę odporności dziecka, jak również przyczynić się do poprawy zdrowia samej matki. Serdecznie zapraszam do wysłuchania wywiadu. You decided to look at the COVID in pregnancy, but with the lessons learned from the previous pandemic.
Well, I think
from where the connection came from? Like, I know it's the viruses, but like how you realize that we can learn from the previous experience.
Yeah, well, mostly because I've been around for a while. And so I had watched what happened with HIV, and as the new research was being published, and as practices changed, so particularly in Africa, in African countries, it was just where there had been such a strong breastfeeding culture. It was just so tragic to see that be lost because of HIV, and knowing that they had so little actual information. They were making these policies based on very little information, and so I was watching that happen in the early 2000s, really, through to 2010, when they finally came. All of the research had come in at that time, and they changed the policy back and said, even if women have HIV, it's still going to, we still recommend breastfeeding unless, you can be absolutely certain that that formula feeding is not going to be dangerous. So I'd seen that happen, that a new disease had come with HIV, that people had not been confident in the importance of breastfeeding and how it protects infants. And so as soon as there was any hint that there could be a possible transmission of HIV via breastfeeding, policies changed, and it was a disaster. It caused, we don't really know how many babies died because of those policy changes, but it was very many. And so when COVID-19 pandemic came, and the very early information, even in early March, it was really clear that babies weren't badly impacted. And yet we had many countries, even countries with very high infant mortality rates, developing policy separating mothers and babies from one another, and the US CDC doing the same thing, saying, isolate infants from their mothers if they have COVID-19. It was just so similar to what had happened with HIV. And so the paper came about. I contacted other colleagues. I had conversations with them about it, and they were saying the same thing. We don't understand why health authorities are developing policies not supportive of breastfeeding, when we know how important it is, when we already had this terrible mistake happen with HIV, how can we be repeating it again? And so, yes, I had conversations with colleagues, and then I contacted Anna Koutsoudis, who was one of the researchers in Africa who actually did the research to show that transmission rates through breast milk of HIV were very low when it was exclusive breastfeeding, and that those programs, the policies that supported formula feeding for women who are HIV positive were actually really dangerous.
Mm-hmm.
So, yeah.
That's incredible story. Like whenever it was the HIV, I was like small, like maybe too small to actually realize how impactful that was. So yeah, it's incredible story, and so like I really impressed that you pick up this quickly, so actually we can learn more on it. And based on that, like what could be the magic, in quotes of course, ingredient of the human milk and breastfeeding process to the infants that could be such detrimental when it comes to baby health and in recent time context of protecting against the COVID and previously against HIV?
Well, I mean, you've got a couple of aspects that are really important, actually. So there's the aspects to do with the anti-infective properties of breast milk, of which there are many. There are ingredients that actively and passively work to protect babies from infection, and also if they become infected with a disease, help them to fight it off. But there's also what comes with breastfeeding is the close contact between the mother and the baby. And that in itself is a really important thing, because babies are so vulnerable, and they need to have a caregiver who's absolutely committed to them and who is responsive to them. And breastfeeding really helps women to be able to do that, which is especially important in times of stress. We have at the moment with COVID, so many people have lost their jobs. There's lots of financial stress. People have been isolated. They may have had family members who've been ill with this virus. There's lots of things that are going on to make times very difficult for new mothers. And when times are really difficult and stressful, breastfeeding is so important because it reduces women's response to stress. And it also, it actually helps them and helps them to be responsive to their babies. It helps them to provide that sort of warm care that newborns need. So we've got those two aspects of breastfeeding that help to protect infants in any emergency, but particularly in an emergency like this, an infectious disease emergency. Having breast milk for the baby is so important.
So actually it's more about the human to human contact and this kind of interaction rather than the breast milk itself. But what about the women who, because of the mentioned stress, they just cannot engage with the infants because from other different factors are detrimental, like other stress, like postpartum stress and so on? How to encourage them to try at least to feed them, to breastfeeding the baby and stay with the baby? Because you mentioned that helps them, but it's hard to convince someone if someone just don't want to do something.
Oh, absolutely. I mean, you can't make anybody do anything. But I think what we have actually seen in this pandemic is a lot of women who had previously decided not to breastfeed, changing their minds. You know, so we very much we found that in Australia. I did some research with the Australian Breastfeeding Association with their volunteers, and during our first lockdown back in April and May, had many women looking for assistance with relactation. So there were women who had stopped breastfeeding, or they hadn't breastfed at all, and they were contacting ABA saying, because of this pandemic, because I'm worried about, I want to protect my baby, I'm worried that I might not be able to buy formula, you know, can you help me to restart breastfeeding? So I think that there's undoubtedly some people for whom it really won't matter what the circumstances are, that they don't want to breastfeed, and that's just how it is. But for lots of women in this pandemic, it seems to have actually increased the value that they place on breastfeeding. And so women are wanting to continue breastfeeding for longer than what they'd previously planned again. So, yeah.
That's good consideration. I'm so glad to hear that, because I thought that my tendency will be totally reserved, because you know, we are in stress, like women are in stress, like there's so many things going on, and then the breastfeeding, like in normal situations, some women I knew that they are not keen on of breastfeeding, and here this tendency, that's nice. That's nice to see that the health consciousness increases. And the other thing which I wanted to ask you, because you're collaborating with different societies and you have other research partners in this area, what would be your opinion on delivering baby in hospital or in the home? Which do you think doesn't matter in current pandemic situation, or it's probably the same, like it doesn't really impact of the risk?
I think I mean, it has been a very difficult time to have a baby, and sometimes hospital policies have meant that I know in some places, for example, women haven't been able to have a support person with them when they give birth, or there have been restrictions on what, you know, on what they're able to do when they give birth. So they haven't been able to have a water birth, or they haven't been able to have particular sorts of pain relief because of COVID-19 policies. And they haven't been able to have visitors after they've had the baby. For some women, that has, you know, those things are things that are important to them and make them want to have a home birth. And I think in lots of places around the world, women have chosen to have a home birth because they've wanted to avoid those policies that they see as being detrimental, but also too because they've actually been worried about going to hospitals because they don't want to get infected. So, I mean, I think it really, whether a home birth is going to be beneficial or better in whatever situation, it's really up to an individual situation, I guess, is what I'm saying. Here in Australia, home births are really hard to, they're easy to get, so it's quite difficult to find. There aren't very many home birth midwives, and it's quite expensive if you want to have a home birth, and so so that makes it difficult for women. But I know in the UK it's much easier to have a home birth. Certainly it's an advantage in terms of, you know, being able to avoid the hospital environment if you've got high rates of COVID disease in the community. you can understand why women would prefer to have a home birth and avoid the hospital. So I think the short answer is it depends, doesn't it? Something that we've found here that's been, I guess, quite disturbing is that some of the our government hospitals have actually had quite good policies and procedures around keeping mothers and babies together, but some of the private hospitals haven't, and so there's been situations where women and their infants have been separated from one another because of hospital policies. I mean, you want to avoid them at all costs, really, don't you? And so if you're in a place where if you're suspected of having COVID, or if you may actually have COVID, and that the hospital policy would separate you from your baby, then a home birth would definitely be something that you would want to do. So I think in terms of emergency response, countries that have that flexibility, so that they have both widespread hospital based birthing programs and also home birth programs, I think that that's a good thing, because you want to have flexibility in the system to be able to respond in an emergency situation. So I think, yes, the UK is probably better off than Australia in that regard, and New Zealand as well, because they have quite easily accessible home birth programs.
Yeah, that's good to always. It's good to have more options rather than just be bounded to the one decision. But yeah, actually, the point that like going to deliver baby at home, it kind of protects from the potential exposure to the COVID, where hospital is kind of place.
Yes.
You never know. We can keep
Yeah.
the measures, but in the end of the day, there's different people. There is a kind of public place as well. And just wondering, because talking about that most women probably deliver baby in the hospital, the first days whenever they came back home, what would be your advice in terms of visitors or like starting normality in this pandemic when you have a small baby, and sometimes you need to go to grocery to get your food, sometimes some people need to go to work or partner is during the work, and still they have contact with the potential COVID exposures. And what would be this normality on daily basis, in the same time to not get crazy, but also having in mind that, okay, we have a small vulnerable person in the house now, so we need to kind of watch what we are doing.
Yeah, I mean, it's one of the I guess it's not an upside, but one of the good things about this virus is that babies really aren't badly impacted by it. It's very rare for an infant to get seriously ill because of this virus, which is a really good thing. I hate to think what it would be like if it were otherwise. If infants were becoming seriously ill, just how terrible that would be. But that's not how it is. So I think the first thing is for parents to be reassured that it's very unlikely that their baby would get seriously ill from COVID-19. The second thing would be, of course, breastfeeding protects against infections of all kinds, including this virus. So antibodies to the SARS-CoV-2 virus have been found in breast milk. We know that breast milk contains many anti-infective properties that protect babies against becoming infected with viruses, and that if they do become infected, that breast milk will help them to fight off the infection. So breastfeeding is an important thing that mothers can do to help to protect their babies. Insofar as going out and doing things and being exposed to other people, I think it's important to follow the recommendations that there are generally for wherever you are, in terms of what to do and what not to do, because things can change so quickly. At one time in a country it might be quite community transmission rates may be very low, and so going to the shops or on public transport even, or going to a park, different places will be a really low risk thing to do. And at other times, when infection rates are really high in the community, those things might not be advisable for anybody to do if they can avoid it. So I think following or keeping up to date with what's happening in your local community is important. I think it's also important for parents to know that they can often access various supports online. And so if you're able, if you're not able to go somewhere in person, that you can get support in other ways, but also not to, if you are concerned about something with your baby, if you're thinking that there might be some problem, if their vaccinations are due, not holding back and not seeking care, because that is something that we've also seen happen all around the world, is that the numbers of visits to health professionals with children has decreased. And there's a bit of concern that that might mean that there might be some children who are in need of medical treatment and who aren't getting it because their parents are worried about taking them to the doctors or to a clinic. Yeah, I mean, as I said, from what we know about this disease, the rates of serious illness in infants from it are extremely low. And it's more likely that other of greater concern for babies. So if your baby does become sick, or if you are worried, that their weight gains might not be as good as they should be, or there might be some other problem, not holding back and not going to see the doctor is, it's just, if your baby looks like they need a health professional to have a look at them, seeking that care is important, even with COVID-19 in the community.
Yeah, I think that's a very important message, because as you mentioned, like people were like limiting the possible visit in the hospitals, which of course makes sense, but if you in need, you need to go. The same without the pandemic, you only go if you need it. No one is going to hospital just for leisure, I would say. And I think this message will be very important, because I heard so many opinions from mothers that, oh, like maybe we can treat this at home, and then the disease became like normal cold became more serious, and then actually it's not only kid or small child itself, but the other environment is in danger as well. So I think keeping it in mind would be very important to remember that very well. So I think we got wonderful advice from you, and thank you so much for sharing your experiences and of course lessons learned. I think this story is very, very nice, and I hope this guidelines, your work will help women to become more confident into the breastfeeding, and of course it will benefit the baby's health and the woman's health as well. So thank you so much for your time. And as
You're
I mentioned,
welcome.
it's evening now, so I will let you enjoy your evening time.
I have another meeting in 2 hours.
Oh, really?
So
My goodness, you are on this schedule.
but I was just to add one last thing that I think is important, and that is for women to know that even though these circumstances are stressful, stress does not have any impact at all on their ability to make milk. So sometimes when mothers are very stressed, their babies can pick that up on that from them, and they can become like a bit fussy at the breast, and sometimes the flow of the milk from the breast can be a bit slowed if mothers are very stressed, but it does still keep flowing, and the baby, if the baby keeps feeding, they will get enough milk. But I know that lots of mothers get concerned about stress having an impact on their milk supply, and I think that, you know, that's been one of the things that you know, that just to reassure them that there's no problem with their milk supply. If they just keep feeding their baby, everything will be fine.
And then, as you mentioned, skin to skin contact with baby will remove all of the stress. So once we start, it's the easy way. Just to start. Don't think, just start. Yeah, that's wonderful.
Absolutely. No worries.
Thank
you. It was lovely to talk to you, Joanna, and